Okay, it's all yours.
So today we're going to be looking at artifacts in breast ultrasounds, their benefits, and some of their pitfalls. Our objectives for this presentation is to have a look at what artifacts are, the type of artifacts that affect our image in breast ultrasound, the physics related to the formation of these artifacts, the benefits of each artifact in diagnosis, and the possible pitfalls that we may encounter in making a diagnosis with regards to these artifacts. So what are artifacts in ultrasound? They are basically a false representation of anatomy. And this is caused by a false assumption with regard to sound propagation and interaction within tissues. It can also be caused by malfunctioning of equipment or electrical interference, and it can also be caused by suboptimal adjustment of our general 2D settings. Why is this important for us in diagnosis? It gives us an insight into the composition of the tissue. So it helps us to define whether a structure is solid or cystic. Does this specific structure we're looking at have calcified components in it? And then therefore it also gives us some insight into whether a structure or a lesion is benign or malignant. Let's have a closer look at the various types of artifacts that will affect our image in breast ultrasound specifically. The first one we're going to have a look at is edge shadowing. And this is a refraction artifact and is due to the change in the beam direction from the transmitted beam when it hits a target or a lesion, but not at a perpendicular angle. Okay, it can also be caused by a drastic change in the speed of sound in two mediums. And this artifact usually occurs in round structures or round lesions. What are some of the benefits in diagnosis? Well, we know edge shadowing to occur mostly in fibroadenomas, as well as in some cystic lesions, but they may also be associated with some malignancies. Therefore, according to the article stated below, they don't consider this artifact to have much diagnostic significance. However, it does have a pitfall. Edge shadowing can occur over a fat lobule, with giving it the appearance of a mass. How can we avoid this from happening, or how can we counter this effect? If we just increase our transducer pressure slightly, or change our angle at which we're scanning, we may counter this. And they also believe that color Doppler may resolve this problem. The next artifact we're going to look at is acoustic enhancement. And this usually occurs in fluid-filled structures and is caused by the low attenuation in fluid in the returning echo strength from structures posterior to the fluid-filled structure. So let us have a look at these images. Our first image, you can see the cystic lesion, and below the cystic lesion, we see the acoustic enhancement. This is a simple cyst. Then we look at the image at the bottom, where we've got a more complex appearing structure, which may be confused in some cases for maybe a solid lesion. But if we have a look below, we can see the posterior acoustic enhancement, which gives us an indication that this structure is cystic. Sorry. Okay, then benefits to posterior acoustic enhancement is that it's mostly associated with cystic lesions, therefore giving us an indication if a structure is solid or cystic, as we saw in the slide before. The potential pitfalls is that these lesions may this artifact may also be seen in certain malignancies, such as invasive ductal carcinoma, metastatic nodules, as well as lymphoma. And this usually gives us an indication that there is a cystic component to the lesion. So if we look again at this images here, we see this is a ductal carcinoma. We see the lesion here. Oh, sorry, my computer is giving me trouble. And we see that there's posterior acoustic enhancement behind the lesion, and this is most likely caused due to a cystic component within this lesion. Okay, our next one is acoustic shadowing, and this usually occurs in a very solid or dense structure. And this is due to either a strong reflection or of the beam, so most of the beam is reflected back to the transducer, therefore we see nothing posterior to the structure. Or it can be due to strong absorption of the ultrasound beam, and therefore we still don't see anything posterior to the structure. So we can refer to the images on the right side of our screen, and we see at the top image we've got two calcified or calcifications with posterior acoustic shadowing, and then we've got at the bottom a malignancy, which is also causing posterior acoustic shadowing, and this is likely due to microcalcifications within the lesion. The benefits is that it gives us an indication whether there is calcium deposit or very dense breast or dense tissue within a specific lesion. And this generally is known to indicate malignancy in ultrasound, but may also occur in benign lesions. As we can see in the image on our left, this is a calcified oil cyst. And as you can see, the rim is calcified. And then we've got the posterior acoustic shadowing. There are quite a few pitfalls to this artifact. The first is that, as we said in the previous slide, this may also occur in some benign lesions, as we saw the calcified oil cyst, but it can also occur in hyalinized fibroadenomas and focal stromal fibrosis. The other one we should be very cautious about is the nipple shadow, and this may be due to some calcifications in the region within the nipple or just very dense tissue of the nipple. It is important for us to correlate always with mammography, and if you try and counter this artifact and there is still something suspicious and you've correlated with your mammogram, you can call it. But if it disappears with your countering, then and there's nothing on the mammogram, then you know there's nothing there. So how do we counter this? By basically just changing our angle of incidence. Okay, another pitfall is that we can see this with Cooper's ligaments, which is normal anatomical structures within the breast, as they are highly reflective and may cause posterior acoustic shadowing as well. This can be countered by increasing our transducer pressure or changing the angle of incidence. The next artifact we're going to look at is side lobe artifact, and this usually occurs in anechoic structures. This happens when the side lobes from the central beam is reflected outside of the central beam, okay? And they hit a highly reflective target, and it appears as though they are formed or originated from the central beam. And this causes bright, round lines within an anechoic structure. As we can see, pointed by the arrows, these two side lobe artifacts. There's not much diagnostic value to this artifact. However, it may give us an indication that a structure is cystic. The potential pitfall is that this may cause the appearance of echoes within a cystic structure. Therefore, it may cause a simple cyst to appear complex. This can be countered by changing either the patient position or your transducer angle. It can also be countered by adjusting your overall gains or reducing them. Reverberation artifact. This happens when two partially or parallel, highly reflective surfaces repeatedly reflect the beam back and forth before returning to the transducer at different times. This shows as multiple equidistant parallel lines and is most often seen from the anterior wall of a cystic lesion. As we can see on this image to the right, we've got our cystic lesion, and then from the anterior wall, we've got multiple parallel equidistant lines. This may cause the appearance of echoes within a cystic structure, and therefore, again, making a simple cyst appear complex. This can be countered by changing the angle of incidence. Our next artifact that we're going to look at is the snowstorm artifact, and this is particularly seen in extracapsular rupture of silicone prosthesis. A similar appearance is also seen in axillary nodes in silicone lymph adenopathy, and this has a heterogeneous echogenic appearance. So as we can see in the top picture, we've got a lymph node, and we've got echogenic material and this heterogeneous snowstorm appearance behind it. On the bottom picture, we've got the silicone implants. We've got a break in the implant with our snowstorm appearance. The next one we're going to look at is volume averaging or slice thickness artifact. And this is due to superimposition of adjacent structures and is caused by the beam divergence past the focal zone. So if we have a look at these images, if we look here, the structure within the focal zone is seen as separate to the structure next to the focal zone. Okay, if we look at the next image, the two structures are both past the focal zone and both appear to be superimposed on each other. So they have the appearance of being one structure. And it causes, again, these artifacts within a cystic structure. Okay, so this may give rise to the appearance of sludge or debris within an anechoic structure. And this can be countered by adjusting your focal position. The next artifact that we're going to look at is ring-down artifact. And the ring-down artifact is basically echogenic bands perpendicular to the transducer and is formed from air. This can be seen as a solid streak or series of parallel bands radiating away from a gas collection. A very distinct feature of ring-down artifact is that this artifact continues throughout the screen. So it extends from where the gas collection is right to the bottom of the screen. In other words, it does not dissipate with depth. It is theorized that ring-down artifact is caused by fluid trapped between a tetrahedron of air bubbles. This causes the ultrasound wave to infinitely reflect back, resulting in an infinitely long vertical echogenic line. So we can see the gas bubbles here, and we can see fluid trapped within it. And if you look carefully, you'll see a long line carrying through the image. So if you imagine you standing in front of a mirror and you've got another mirror behind you and you see an infinite number of yourself within the mirror, it's a similar effect happening here. Our next one is comet tail artifact. And comet tail artifact is a form of reverberation artifact. And this occurs when two reflective surfaces are closely spaced together, such as the tip of a needle, and causing difficulty in distinguishing between two reflective echoes. Okay. Unlike ring-down artifact, it's important to know that comet tail artifact dissipates with depth, therefore causing a tapering shape. So we can see there's the tip of a needle and the ring-down artifact, which stops at a certain point within the image, at a certain depth within the image. In breast ultrasound, the air is most likely caused or introduced by a biopsy needle, which can cause the ring-down artifact, or the tip of a rounded needle, which gives rise to the comet tail artifact. Therefore, these artifacts aid us in identifying the tip of a needle during biopsies. Just in general, we can see that adjusting our 2D settings optimally plays an important role for us in diagnosis. Okay? And ensure that your overall gains are not too high. Ensure that your focal point is over the structure under examination. And ensure that your dynamic range is set optimally. The take-home message for tonight is that artifacts may aid us in diagnosis. However, we should be aware of the possible pitfalls that may lead to misdiagnosis. This is therefore important to know these pitfalls and how to counter them. Another thing that is important is for us to consider all the other features of a lesion in making a diagnosis, and not just to rely on an artifact as an aid in, or it's an aid in diagnosis, but not the main consideration. Also make use of other ultrasound modes in order to aid in diagnosis. For instance, adding color Doppler to a lesion. Thank you for your time.
Thank you so much. That was so cool.
Could you hear me all the way through?
I could hear you all the way through. I know, obviously, I think there was pop-ups that were coming up. It must be because of the electricity situation, isn't it?
Yeah, I don't know what's going.
Screen.
I don't know what's going on because my computer is not functioning the way it's supposed to. But was that okay?
No, that's fine. So, oh, sorry, I need to stop the recording.